This November, we're celebrating the scholars you've probably never heard of, but definitely should have. Susan La-flesche Picotte was 8 years old when she watched an Indigenous woman die. The woman was ill, suffering, and the local white doctor refused to come. He simply wouldn't treat her. The woman died, and the young Susan decided then and there that she would become a doctor. And not just a doctor, she would become a doctor who would never turn anyone away. And she kept that promise, and in doing so, she became the first Native American woman to earn a medical degree in the United States. Picotte was born in 1865 on the Omaha Reservation in northeastern Nebraska. Her father, Joseph La-flesche, was the last recognized chief of the Omaha tribe and a proponent of education. Susan attended mission schools, then the Hampton Institute in Virginia, and finally the Women's Medical College of Pennsylvania, the first medical school in the United States established specifically for women. She didn't just attend, she graduated top of her class in 1889. At 24 years old, Susan La-flesche became the first Native American woman to earn a medical degree. And then she went from home. Then she went home. For the next 25 years, she made house calls on horseback and by buggy, traveling through brutal weather across rough terrain to reach patients who had no one else. She treated everything: infectious diseases, chronic illnesses, childbirth complications. She was the one doctor available for miles. But Picotte didn't just treat physical ailments. She was a public health advocate, campaigning for sanitation improvements, better housing, and temperance. She suffered from painful bone and ear infections for most of her adult life, and in 1913, 2 years before her death, Picotte achieved something extraordinary. She opened a hospital on the reservation in Walt Hill, Nebraska. It was the first hospital on a reservation that wasn't funded by the government. She raised the money herself, mostly from private donors and her own savings. It served everyone. Literal systemic attempts to erase their cultures, languages, and lives. The US government forced indigenous children into boarding schools where they were punished for speaking their language. Treaties were broken, land was stolen, communities were devastated by disease, poverty, and violence. And in the midst of all of that, she saw healthcare as a form of resistance. Every patient she treated, every life she saved was an act of defiance against a system that wanted indigenous people to simply disappear. She proved that Native Americans could master Western medicine, could serve their communities, could thrive if given the chance. Susan La-flesche Picotte died in 1915 at the age of 50. It's only recently that historians and educators have started to reclaim her place in medical history. We talk a lot about healthcare access, about doctors serving the underserved communities, about medical equity. Susan La-flesche Picotte was doing that work over a century ago. She was the first, but she shouldn't have been the last person. She was the first, but she shouldn't have been the last person we remember. So keep learning and keep questioning.